Okay, so lower back here, okay, in this region, it's the lower part of your back. Now when you start to go into the parts below that, into your glutes, that's when you can start diving into the realm of sciatica a little bit. But I'm gonna put a picture right here, and you're gonna be able to see the length of the sciatic nerve and where it exits, but we're also gonna use my trusty little spine here to help us out. So when we have the anatomy of the sciatic nerve, we notice that it comes from the lumbosacral plexus. And so we're looking at the lumbar part of your spine, L1 through L5. People have heard of that before. L5, S1 is the most common area for disc herniation, et cetera, et cetera. So we're looking at lumbar sacral plexus, and it comes out and exits into the glute near the piriformis muscle. And you'll see that in this picture over here. And nerves are often classified as things that are yellow, but in reality, they have a little bit more of a white hue to them. But anyways, so we're gonna have that picture here, and you can see that the sciatic nerve exits the lower back, and it comes down and exits the glutes, and it goes all the way down the leg, and we're gonna go right in the middle of the hamstrings. And so when people think they have lower back pain and they actually have sciatica, you're gonna notice that the lower back pain typically only extends into the glutes and maybe the upper part of the back of the leg where your hamstrings are. Back pain itself typically does not extend into the calf. And so, but when you look into this picture, you can see that the sciatic nerve exits the lower back, goes through the glutes and down into the back of the knee, and at the calf it splits, but we could still classify that as the root of the sciatic nerve at the root, and it goes into two different nerves. And so people who have sciatica rather than lower back pain typically have pain past the knee, where people with back pain typically don't have pain past the knee, solely just back pain. And so the sciatic nerve then courses at the back of the knee, splits into two beautiful nerves that gives us strength and sensation into our calf and foot. That's why with sciatica, sometimes you can have numbness and tingling into the foot or the calf area, and then it goes down into the Achilles and the bottom of the foot, and it branches off into smaller nerves as well. But when you trace those course of the smaller nerves all the way back up, then you're perusing back into the area of the sciatic nerve. So it exits the lumbar sacral plexus, it comes out, it comes into the glutes, comes back down, and goes all the way down. And so a lot of times, classic example with my clients is that they point to their buttock and they say they think they have sciatica. But then I have to go through a little anatomy lesson and do my examination to figure out, is this more lower back or is this more sciatica? But people who have classic sciatica type symptoms, I'm gonna have a video on that too, is that they're going to have that pain and discomfort down lower into their leg. And you really need to have that characteristic to be classified as sciatica. And so where the sciatic nerve lives, it's a gigantic nerve that exits the lower back, comes down into the glutes, and it's a beautiful, beautiful nerve that gives us a ton of strength and sensation, and it does a lot of good for us. But with activities such as sitting, you can put a little bit of pressure on it, and some people have a little bit of a anatomical variety in that some of the muscles give that nerve a little bit more compression than the average person, so they may have a little bit more susceptibility to sciatica. But the end thing that I really want you to walk away with is that the sciatic nerve is a combination of the lumbar spine and the top nerves of the sacrum. It comes out, they have these like branches that come out like this. You can see these yellow pieces here. They converge, they come together, they exit our spine, and they go down the leg. And it can be a nasty, nasty nerve if you're having some issues, but it has a wonderful, wonderful function. And I hope you guys find this little anatomy lesson helpful, because I think it's helpful knowing where the nerve lives to have a better understanding of where you may or may not have discomfort. And so when I have patients with sciatica, what they believe to be sciatica and or lower back pain, we always go through this little anatomy lesson, and the knowledge of the anatomy combined with the physical exam gives us a good place to start to figure out what best treatment options there are. Now, I want to give you guys a little bit of a bonus here. So think of this. When you've ever had sciatica and they have you do nerve glides, they always have you move your foot in your lower leg because the nerve travels all the way down there. It makes sense, right? If we're trying to improve our back pain, only back pain, I'm not going to have you move your foot up and down because there is no correlation. There's nothing that travels that entire length. And so just keep that in mind. When we think of it like that, it makes sense. And so today I wanted to cover the anatomy of the anatomy of the sciatic nerve, because it's a great nerve. I think it's worth knowing because a lot of people think they have it, but they actually don't. And some people may actually have true sciatica and they think there's something wrong in their calf or their knee. So I think it's worth knowing the anatomy. If you guys find this helpful, please leave a comment. I mean, anything you guys know, there's a lot of variety with anatomy out there. You look at different textbooks too, but in the grand scheme of things, we don't have to dive too deep to understand that that nerve starts in your back and can travel all the way down into your foot. And so if you guys like this information, please leave a comment or subscribe to the channel so I can keep just producing super fun information and it can be helpful for you guys. But as always, guys, stay healthy, keep moving, and take care of yourself.